and as athletes are more prone to knee injuries because of the sports they play.
Yes,
So
there is a relationship of athletes with the knee pain. Knee pain in athletes is deeply connected to repeated stresses, high impact forces, then sudden pivoting moments which can put it 10 times more than that of a normal person. So in most common sports like basketball, soccer and running, the incidence of knee pain is more. So the common cause again is overuse injury, patellofemoral syndromes, ligaments or tendon strains, sprains or tears and meniscal tears.
तो कोई ऐसा precaution?
Yes, precautions which an athlete has to take is there should be targeted lower body strengthening, especially the quadriceps, hamstrings, and the gluteus muscle. There should be strict adherence to dynamic warm-ups. Before you start the athletics, there should be proper adherence to warm-ups. There should be gradual progression of training intensity. There should not be sudden you start high jumping. It has to be a very gradual process. There has to be proper technique. The athlete should be taught a proper technique of having that particular type of the athletics. In between, you have to have adequate rest. You need to have adequate rest, and there has to be a proper gears, which are very crucial. So, what are they? They are supportive footwears and protective gears around the knee joint. Then you listen to your body also. An athlete should listen to the body. Don't ignore minor aches or swelling. You don't think that it's a minor ache, nothing. Listen to the body. Just wait for some time. Pushing through a sharp pain quickly turn a minor inflammation into a major one.
So, was it a myth or a fact कि knee pain के time पे exercises बिल्कुल बंद कर दो या सीढ़ियाँ चढ़ना?
Acute phase में नहीं करनी चाहिए. In acute phase में you should stop exercise. सीढ़ियाँ चढ़ना you should reduce it. In acute phase you must go to a doctor. Take the advice of the doctor. See what is the cause of the knee pain. Right. For example, if it is meniscal tear, if it is tear of the ligament, so going up the stairs or walking should be prohibited. Proper rest should be given to the knee joint. If it is an acute inflammation, again the knee should be immobilized. Right? If there is a massive ligament tear, the knee should. But as I spoke to you earlier, if there are minor causes, in that you can have some amount of the acuity. But the best thing is to go to a doctor, and of course, after following the advice by the doctor, you have to take the help of a physiotherapist.
जैसे every athlete and everyone should have a physio connected to a physiotherapist. So
yes.
Can you tell us the role of physiotherapy in knee-related issues?
Definitely. The key reasons why it works so well, the physiotherapy. The role of physiotherapy ultimately is the best. Initially, for example, as I said, if there is an infection, you have to treat the infection. If there is a severe injury, you have to give the painkillers and immobilize. But ultimately, you cannot just sit at a place and remain immobile. You have to use for every acuity, walking, etc., we have to use our knees. So it is a physiotherapist who can make our knee joints mobile.
अक्सर लोगों को फिजियोथेरेपिस्ट से या फिजियोथेरेपी को लेके एक मिसकंसेप्शन रहता है कि मसाजर्स ही तो है, they only do massage.
No, that's a misconception. Physiotherapists in olden days, they used to say there used to be a quack outside your house and would do some massages and put those wooden strips and would say that this is no massaging in certain conditions like in ligament tear or in meniscal tear will be very detrimental. You have to fix up. If it needs surgery, you have to do the surgery. And afterwards, because after surgery, you have to immobilize. Like you do the knee transplant, after that you have to immobilize. And who immobilizes? It is a physiotherapist who immobilizes. So please, I request everyone that you should not go to a massage quack. You must go to a proper trained physiotherapist. Physiotherapists will give you different types of physiotherapy. There may be massage, there may be ultrasonic massage, there are certain electrical stimulation, so on and so forth, which ultimately cures you. I have a personal, once upon a time, long time back, I had some problem with my wrist joint, and my, these painkillers, etc., didn't help me. But then I went to a physiotherapy, they gave me massage, they gave me some electrical stimulation, and they put my hand in the wax hot bath. And I tell you, my sprain, my joint pain of my wrist vanished like anything. Moreover, I had plantar fasciitis, which was giving me intense pain while walking. Again, it was the physiotherapist who relieved me of my problems, and today I can walk very nicely thanks to the physiotherapy who gave me this.
So it's like they have magic hands and knowledge.
Physiotherapists have magic hands, but all physiotherapists, besides having magic in their hands, I suggest they should have magic in their words, in their attitude, because your attitude, your words, and the way you deal with the patient, it releases 50% of it.